Hello everyone, my name is Edmund Ang Matrix number of 137806. I'm from Group 273 for LHP 456 Spoken English, and today I'm going to talk about Obsessive Compulsive Disorder for my individual oral presentation. Let us begin. Take a few seconds to admire these photos. You can see that most of the items in the photos are well organized by color and are arranged very neatly, especially the bowl of M&Ms down there. How about these photos? As you can see, the towels and the manhole cover are not placed where they should be, or even the pencils are of irregular lengths, or maybe even a cake which is cut in an abnormal manner. Now, does these photos trigger you? Or do you have the urge to get things straight or double check on things? For instance, arranging your clothes by color or even a particular manner, or checking that the door is locked every time you head out. Now, once in a while, you might think that, isn't this normal that we do all this stuff? Well, what if you feel compelled to triple check or even quadruple check things? That might be considered an obsession. What if you have a certain ritual before doing anything? That might be considered a compulsion. So, what is OCD? Obsessive Compulsive Disorder, also known as OCD, is a specific type of anxiety disorder which are characterized by these obsessions and compulsions. Obsessions are recurrent or intrusive thoughts that are unwanted and hard to get off the brain. These thoughts like, my house is unsafe or my hands are dirty, can cause serious anxiety, and usually they lead to compulsions, which are actions that might be performed to reduce these anxieties associated with the obsessions. As you might imagine, these thoughts and rituals can have a serious impact in someone's daily life. Although OCD often includes obsessions and compulsions together, one does not need both obsessions and compulsions to be diagnosed with OCD. Some individuals might just have obsessions or just compulsions, but the majority of patients have both, often when the compulsions are performed to alleviate an obsession. A very common compulsion is cleaning, which often stems from an obsession of germs or contamination. Another compulsion is checking, usually because they have the obsessions that something is unsafe, so they will check if something is really safe by locking and unlocking repeatedly, for instance, a house padlock. More generally, repeating is a compulsion on its own, where an action of race is repeated several times. And this is usually done because they think that something bad is about to happen if they don't repeat it. For example, someone might flick a light switch on and off for a ridiculously number of times. Sometimes patients might feel compelled to order and arrange things because it causes serious anxiety and discomfort when they are not neatly arranged. For example, books arranged according to numbers, or even the clothes arranged according to color. Now you might think that this is normal that we do all this stuff. Well, yes, it's when those compulsions consume you and you don't have control over it, but it has control over you. This is what causes it to become a disorder. Now, who has OCD? OCD affects around 3% of the world's population. It affects both men and women equally and usually start during the childhood or the teen years. Celebrities like David Beckham and Howie Mandel are known to be affected with OCD. Unlike most mental disorders, there isn't a known cause for OCD, although it's thought to be a combination of genetic and environmental factors. Sometimes, OCD seems to run in families. It is now thought that the deficiency in serotonin neurotransmission in the brain plays a key role, although the exact mechanism is unknown. Treatment usually involves psychotherapy, medications, or both. Among psychotherapy options, cognitive behavior therapy has been effective, specifically a technique called exposure and response therapy, where patients are first exposed to the anxiety and compulsion provoking situation, ultimately showing that the anxiety lessens when the compulsions are not carried out. Because the cause have been linked to serotonin, selective serotonin reuptake inhibitors, or also known as SSRIs, have shown to be an effective drug treatment, although they often come with some symptoms or side effects that might need further treatment of medications or even psychotherapy. However, with the right treatment, patients often return to their normal daily life and activities. Last but not least, how can we help OCD patients? First, we must always be understanding and supportive of them. Many OCD behaviors might be irritating and demanding, but we should not blame them whatsoever. We can encourage them to seek professional help or even talk to them so that we can learn how it affects them and be more supportive. As a summary for this presentation, OCD is a serious mental disorder and shouldn't be taken lightly, although it does little to no harm to the body. Well, I'm not here to diagnose you, but if you ever feel like you have symptoms of OCD, please do get help from a psychiatrist as soon as possible. Last but not least, if you come across any friends or families diagnosed with OCD, try to understand and be supportive of them and never judge them or bully them in any ways. Alright, that's all for this presentation. I hope that you've learned something new from this. Thank you so much for your time and hope you have an amazing day ahead. Thank you.